That is the difference between a life-saving surgery and a dropped insurance plan. As 7 News reporter Russell Haythorne explains, those 2 cents could cost one Vietnam veteran everything.
It wouldn't be so tough to swallow.
Everybody's very surprised that 2 cents is enough to do this.
If it weren't such an innocent mistake.
If I only would have just hit the 9 instead of the 7.
When Frances Flanagan was paying their monthly health insurance premium in November, she swapped a 7 for a 9, leaving their $328.69 payment 2 cents short.
And now we're just pulling teeth and trying to figure out what's the next step.
Their insurance has now dropped them.
Since then, I've been depressed. I haven't been able to hardly do anything. As you can tell, we still have our Christmas decorations up, so it's been hard on me.
That's because Ron has been fighting cancer since 2008, multiple myeloma in the bone marrow. Doctors at St. Luke's have performed stem cell transplant surgery twice. But Ron needs another transplant before the end of February, and they have a donor, but because of that 2 cent mistake, Ceridian Cobra Services says no coverage, no transplant.
They never did like a certified letter saying, you know, what could happen. They never did a phone call.
The cause of Ron's cancer is likely exposure to Agent Orange while Ron was on deployment in Vietnam. Now he waits.
My doctor said I could not wait, you know, like months to decide on a transplant.
An innocent error with so much at stake.
I spoke to my sister-in-law, and that's when I broke down. And I told her that I felt that it's all my fault. And she just said, no, it's not your fault. We have God on our side.
This is an email response we received from the insurance company, Ceridian Cobra. I believe we can zoom it in there. We did not receive a full and timely payment, they say. They go on to say, unfortunately, we simply do not have the capacity to personally call everyone and tell them they're short on their payments. Ron says he might now try the VA hospital for treatment, but that, unfortunately, would require him to travel to Seattle for that